Sorry, in this video bear with me the noise of the generator as there is no light over here. Now there will be some noise in your background while I am speaking. Now this view in front of you is that of the left kidney in longitudinal section, this being the upper pole, mid region and the lower pole. The parenchyma is normal. This is the central sinus echo complex. You will see tiny echogenic particles. These concentrate on these areas. It appears to me as if this is a medullary sponge kidney. Why? The reason is that we know these can be in differential arcuate vessels. Why can't they be arcuate vessels? Because these cystic areas that you are seeing are the pyramids, and these areas, echogenic areas with no posterior shadowing, are seen posterior to these medullary pyramids. This is a pyramid, this is the echogenicity, this is a pyramid, this is the echogenicity. So wherever you will see that the echogenicities are posterior to the medullary pyramid. This is the pyramid, echogenicity, pyramid, echogenicity. In this case, pyramid, echogenicity, pyramid, echogenicity. Whereas these are the arcuate vessels. Arcuate vessels will be seen at the anterior margin of the renal pyramid. This is the renal pyramid, this is the pyramid. Now these tiny particles are the arcuate vessels. So these are not arcuate vessels, these are tiny calcifications seen posterior to the medullary pyramid from upper to lower pole, anterior parenchyma, or that of the anterior parenchyma. So let's magnify a bit to see, and if you see that this is a better view, there is some posterior shadow from this calcification, there is some posterior shadow from this calcification. This is the renal pyramid, this is the renal pyramid, and you can see in this case there is muffling of the central sinus echo complex. The fat that is present over here is showing muffled. So this is a case of medullary sponge kidney unless proven otherwise. So these echogenicities should not be confused with arcuate vessels. Now this is really a bilateral condition. So let's see the right kidney also. Now this is the right kidney. Again, oh yes, you will see the same picture. Whereas there is a calculus, this is the true calculus within the central sinus echo complex, and you can see that the central sinus echo complex is relatively slightly muffled, but it is not that bright as it should be. Now this is a true calcification in the calyces of the lower pole calyces measuring 7.6 millimeters. This is a small cyst, which is these are common in medullary sponge kidneys. Now these echogenicities are again not arcuate vessels. These are suggestive of being tiny calcifications below the renal pyramids, or in the renal pyramids, I would say. So they are seen in all over the parenchyma, and thus this is a case of medullary sponge kidney. And at times you will see multiple cystic areas. This is not direction of the calyces, but rather this is a cyst, because as I change the direction of the probe, it remains the same. I am talking about this cystic area.